Good morning, everyone. It's Friday, which means it's time for the Henry County Health Center FYI. And this morning, I have the distinct pleasure of speaking with the new CEO of the Henry County Health Center, Teresa Colgan. Good morning.
Good morning. Thanks for having me.
Well, I'm so pleased to have you. You know, we had Rob on the radio way back in the day, but now we have Teresa on the radio. So welcome to KILJ and Henry County Health Center.
Thanks.
How are things going?
They're going well.
Very good. Well, let's start off first with giving us a little bit of who you are. Talk about yourself and your professional background.
Okay. Well, I'm married, been married a long time, and my husband and I live north of Burlington, have a little property there. We raise dogs and love working in the yard and like cooking and that sort of stuff. And so when I'm not doing those fun things, I'm working. And with that entails, I started my career at Burlington Medical Center. So I've been around the health system for quite a while. I started as a staff nurse, and then I did that for a while. Then I became the director of the health education department, which then transitioned to corporate education. And when we built the new hospital in West Burlington in 2000, I took a leave of absence for my job for about a year, and I worked on operations. So how are all these departments going to work together in a brand new facility with different adjacencies? So that was really when I found my love for operations. But after that, I spent some time and I was a director of quality. Then I became the vice president of quality. And then with the retirement of the vice president of nursing, I became the vice president of nursing and did that from 2008 until I took this job in July. My titles changed over time, but the work was similar. So I've been around for quite a while.
Well, it sounds like you are, an expert in hospitals, how they work, how they function, and being everywhere from on the patient side, then now in the business side, which seems like a great fit for somebody who's trying to serve both sides, the business and the patients.
Yes.
And I know that's important to the Henry County Health Center. So you just kind of took over, right, for the CEO, or when did that happen?
So I started when Rob made his announcement in January of this year. I started coming over in February. Matt Wenzel, our Great River Health president and CEO, had asked me to take this position. And so starting in February, I started coming over, meeting with the department leaders, and starting to get a feel for the services that were offered at Henry County. And that was a wonderful opportunity to get to work with Rob, as he'd been in this seat for about 13 years. So he had a lot of good advice to give me and help me with my orientation. And then officially I took over July 1st.
So I know, especially with your background and everything you've just mentioned, that clinical integration for the health center is something that's falling under your responsibility. So what does that entail?
Yes. Well, with 3 campuses and with Henry County being a critical access hospital, it gives us different options from a reimbursement perspective. So it really is looking at where should we provide what care, because reimbursement does matter, obviously. And so there are things that in a critical access hospital get reimbursed at a higher level. So we'd like to take advantage of those opportunities. And then also, what services does it make sense to have at what campus to best support the consumer?
Yeah, I mean, that makes perfect sense when you explain it in those simple terms. I know it's not that easy, but okay, so talk about what made you want to then accept this position, move into the CEO role with all of this considering.
Yeah. Well, I think Matt was pretty convincing, I think.
He's
was
good
the
at
first
that.
thing. Yes, he is. No, he asked me if I was up for another challenge. And I thought, what the heck? Throughout my career, I've gotten to do a lot of different things, and it's because I've said yes when people offered me opportunities. And the intriguing part was this was going to be learning about a whole new campus. And I was very familiar, obviously, with West Burlington and the Fort Madison campus, but I was less familiar with Henry County Health Center. And during the pandemic, we did a lot of work between all 3 campuses, and I just saw that there was huge potential for us to work together better. And then with the lease agreement, that made that just all the more easy for that to happen. So I like a good challenge, and I like operations, and so that's part of what this role involves.
Well, you talked about working together with the 3 campuses. We hear about regionalism with the lease agreement. What does that mean, and how does that benefit, the community when it comes to meeting our healthcare needs?
Well, I think, the number one priority for Great River Health is to make sure that we're supporting our region in patient care. Whether that means you drive to one campus or another, those are some of the realities of healthcare now. And people are very accustomed to driving for services and certainly for pleasure as well. So I think when we think about regionalism, we want to make sure that we're providing all the services in our region that we can do with the medical staff that we have, and that we take advantage of any opportunities there are to support everyone.
So what benefits then have you seen so far, between the partnership with Great River Health and the Henry County Health Center?
Well, I think from a Henry County Health Center perspective, having additional resources from Great River Health has been significant. As I get to work with leaders, and I started in March pulling together leaders from all three campuses, it can be lonely when you are in a small hospital. And so developing peer relationships with the other two campuses has been pretty significant for the leaders of almost every service, and figuring out how they can work together to provide the best service to everyone, whether it's patient care, outpatient care, or whether they're support departments. They're figuring out how to do it the best. That ultimately will help support the consumer in the end. But that's sort of where we're at today. And I just know as I visit with leaders, they feel the support of having someone that they can contact that does similar work to run things by, and just some expertise. When you're in a smaller campus, you often are faced with wearing many, many hats. And that's been the situation at Henry County Health Center. But with this opportunity, they have a phone a friend within the health system, and that's been very beneficial.
And I can only imagine with COVID and the ever-changing healthcare landscape that we're dealing with, that's, all the more benefit for the people that work at Henry County Health Center.
Yep.
So, okay, with all of this being said, give me the inside scoop. What is going on at the Henry County Health Center?
Okay, so this first year, one of the priorities is to set up systems. So one of our big priorities is to get Henry County Health Center on the same electronic health record. The other campuses are on a product called Cerner, and so that's a priority to get us up and running. Right now, we're doing a lot of pre-work, looking at workflows and processes and policies and procedures that will make that streamlined till we can actually engage with Cerner to make that happen. That's a huge project. There are other systems that we will go on as a health system as well that will be very, very beneficial, because then information becomes much more readily available and all your systems flow. So I think from a consumer's perspective, when we're all on Cerner, that's one record. So if you see primary care in Mount Pleasant, but then go to specialist care in West Burlington, they'll be able to access your record. And there's just huge advantages to that from a continuity of patient care perspective. So that's probably the number one thing that we are aggressively working on. And then I have been working with department leaders, as I mentioned, from all three campuses, and that's been a big body of work. But they've really gotten to know each other and know what services they do at different campuses. So that's been a priority. I think from a foundation perspective, we're getting pretty excited that in this year, in November, we'll get to have our 100th anniversary
102nd.
gala. I know.
100 and whatever.
We're just a little delayed because of the pandemic. But I think those are the big things that are priorities. And then I think for me, on a personal level, is just getting to know all the people who work at the health center and some of the community members.
Fantastic, Teresa. It's always fun when we get to talk with the Henry County Health Center, and I'm so glad we got to talk to the CEO of the Henry County Health Center. Is there anything that you didn't mention this morning that you wanted to be sure to tell people?
No, I don't think so. I think we covered a lot of ground.
Very good. Teresa Colgan, the CEO of the Henry County Health Center, thank you so much for taking some time to come on and talk to KILJ listeners about everything that's going on, and congratulations and good luck
Well, thanks.
in your new role.
Appreciate it.